There is a public health crisis more deadly than COVID. COVID is exacerbating it, but it's more deadly than COVID. The Lieutenant Governor of Michigan, Garlin Gichrist, joins me to discuss the public health emergency of racism. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. Welcome back. Thom Hartmann here with you. On the line with us is the Lieutenant Governor of the state of Michigan, Garlin Gichrist II. Michigan.gov is the website. His Twitter handle is LTGOV, as in Lieutenant Governor. Gilchrist, Gilchrist. Garlin, or Lieutenant Governor, what title how does somebody address you these days?
Thom, first of all, it is always a pleasure to talk with you and be with you here. And the interesting thing about this job, Lieutenant Governor, is there's like about 70 different ways to address me, but let's just stick with Garlin. It's the simplest one. Okay.
Well, yeah, that's how I was addressing you, I think, the last time we had a meal together. But it's been a little while. But Lieutenant Governor Gilchrist, in Michigan, you guys, and I'm not sure exactly what role you played in this, but Michigan has essentially said that racism is a public health crisis. And, at one level, I think this probably should be obvious to anybody who has, looked at the situation in America for the last 400 years. On the other hand, there are people responding to this with basic freak out. Tell us about it.
Yeah, so I'm proud to have played a major role in this, and I've been able to work very closely alongside Governor Gretchen Whitmer, our governor, and our states had a very strong, we believe, COVID-19 response. We were hit early. We were hit hard. But thanks to, frankly, the diversity in our leadership team of Governor Whitmer, myself, a black man, highest ranking black elected official in the history of the state, our chief medical executive, Dr. Jonae Caldoon, who is also a dynamic black woman, we were one of the first states that started looking at race and ethnicity when it came to COVID-19 infections and deaths. And what we saw is that there were racial disparities in this pandemic, just like there's been racial disparities in health outcomes for generations. And so that's why we created the Racial Disparities Task Force for COVID-19. We're the first state to take that action that will put the full force of state government behind reducing and eliminating disparities in COVID-19. And one of the things that we learned in that work was that, we need to zoom out even farther and look at all of the ways that state government can help to address this public health crisis that has been caused by racism and by how racism has infected the way that systems have been designed, the way that barriers have been constructed to block access to opportunities for people. And so we've unlocked the full power of state government to be able to do the data collection and the analysis and the policy change to be able to overcome the stain that racism has put on outcomes in our state and, frankly, be a model for the rest of the country.
Back on April 7th, when on April 7th, on that day, or the day before, let's say April 6th, the White House, the administration, the federal government, right across the board, and most of the states were all in on, oh my God, there's this terrible virus coming. We've shut down the country now for 3 or 4 weeks. We've got to keep it shut down until we've got this under control. Jared Kushner and Trump and these guys had put together an entire plan to use the Defense Production Act to force the production of test kits so that we could have widespread testing and contact tracing. We're going to do everything right. And then April 7th, the New York Times, the Washington Post, CNN, MSNBC, Fox News all broke the story. ABC, CBS, NBC all broke the story that African Americans and Hispanics were dying about 2 to 1 to white people, even though white people are the majority of people in America. And I was on the air and I said, this is going to change the Republican Party's position on this. And sure enough, within a week, the Freedom Works, the right-wing group that the Koch brothers had been, funded back in the day, that brought us the Tea Party, the U.S. Chamber of Commerce, the Republican Party, the Trump administration, all of a sudden everybody was like, oh, well, then let's open the country back up again right now. And, as a consequence of that, black and brown people are overrepresented in frontline low-paid positions, and white people are overrepresented in white-collar, I can work from home positions. And it's just rolled on since then. Can you speak to that, Garlin, to this idea that even our national policy on COVID seems to have been, you don't have to buy into my conspiracy theory, but seems to have been altered by this information about race?
Well, the truth is, we can put the framing aside and just look at the facts, Tom. I mean, the truth is, President Trump, this should surprise no one that he, frankly, cares less about the health outcomes for Black people and for people of color across the board. And so you talked about the fact that people of color are overrepresented in those jobs that have never stopped working, whether it's working at utilities or first responders or grocery stores or bus drivers. And so we tried to put in place worker protections at the state level because those didn't come from the federal level, from the federal government, from the Trump administration, because that was exposing Black and Latino and Native American people to the virus more. We actually helped to lift the barriers that existed for testing because Trump didn't have a national testing strategy. He certainly was not interested in getting tests where they needed to go in places like Detroit and other places where we have high concentrations of people of color. But we did that and unlocked it and made it more accessible by creating drive-through testing. And we actually created drive-to testing because for people who are relying on public transportation, which are also more people of color than white people in Michigan, for example, you can't take a bus to a drive-through. And so we actually worked with Ford to make these mobile vans where we would drive tests to people in a community. So we tried to break down those barriers that the Trump administration eradicated with their negligence, their ignorance, and the racist outcomes of the policies that they put forward or the policies they did not put forward because they, turned a blind eye, a willing blind eye to this pandemic.
Is it working?
So we have been tracking this data. Yes, we've been tracking this data, like I said, since the beginning. We had our first COVID-19 case on March 10th, actually, which was the night of our presidential primary, incidentally. And what we are beginning to see is that the interventions that we've been taking as a state overall are shrinking that racial disparity gap. We're making sure that we got all the T's crossed and the I's dotted on that verification process. But we get data every week. And we're seeing that it's having an impact, and we think that's a model for the rest of the country. So we're very proud of that, and are looking forward to sharing it with